The iSpot, I applied because they sent out this thing saying you could apply and then you could share your ideas. And we've been doing the personal caring initiative for the last 2 years. And I thought it's an opportunity. And I thought it was a long shot, quite honestly. And I was really welcomed. I was shocked. I'm not a New York designer by any means, but I've had wonderful mentorship and thinking about our program. And so I applied, and they accepted and welcomed me. So I'm delighted. And so I'm presenting on the personal caring initiative. Full recognition of a patient that I cared for that taught me that I didn't have the skill, role, or time to care well for them. Went to get more training. Medical school, fellowship, residency, didn't teach me what I needed. Not to answer the questions of, how am I going to die? Can you help me with my nausea? How about my pain? What will this mean for my loved one when I die? And my mom, by the way, she would trade places with me. I was inadequately prepared, my health system was inadequately prepared, so I went to get more training. And now we have an interdisciplinary team, we've engaged the community, we've engaged the health system, so now we have skill, we now have the role, and we now have the practice model or time to care well for people who are seriously ill and the people they love. I think, some people are going to say, well, palliative care, that's all about end-of-life care. I'm the medical director of palliative medicine, and frankly, it's about helping people live well. That's part of the cultural conversation. This thing about being seriously ill, and yes, some people that are approaching the end of their life, that's really about just being human. This is part of the human condition, and we have to, as a culture, get to the point where this is just a normal part of life, where we live well and celebrate each other. I want there to be a cultural conversation about how we care for seriously ill people and their families. And I want people to understand that the kind of care we're providing, it's not reimbursed by your insurance companies. And in order to do this well, to provide people that you or your family, to provide them the care that they need when they're seriously ill, it takes money, and it takes really a conversation, a national conversation, to transform the care of the people, but also how we reimburse and how we design systems. This is so unique to be able to introduce what we're doing. And in fact, I'll tell you, when I was pitching my talk, they said to me, well, why do you need to do this? Doesn't the healthcare system do this? And I said, where have you been? No, we don't do this well. And so it's a unique opportunity to interact with a lot of people outside of medicine and where I live. So.